Central Illinois is the CI in CI Living. CI Health is brought to you by Aunt Martha's.
It's a disease that affects women of all ages from all walks of life. And we devote 1 month to raising awareness for breast cancer, but we need to pay attention every day. Here with more from Aunt Martha's is Dr. Tamara Lim, Medical Director and Senior Vice President of Quality and Clinical Excellence, joining us via Zoom. Dr. Lim, we appreciate you being with us this afternoon.
Yes, thank you for having me.
All right, so October, everyone is familiar with it being Breast Cancer Awareness Month, but it's really something that we should be mindful of every month. Do you have some interesting statistics that we should be aware of?
Yeah, I think one thing that really changed in terms of the data was that it became the most common cancer globally this year. And so for many years, it's been lung cancer, and breast cancer has really now come to the forefront as the #1 common cancer. And so I think that really shows really the commonality of it. And when we look at the United States and the data surrounding women, 1 in 8 women in the course of their lifetime will have the chance to get the invasive breast cancer. And that's scary. And so we try to make sure that with our patients and clients, we remind them every time they come for their checkup to make sure they get their mammogram if they're due for one.
Okay, so let's talk a little bit about which individuals should be screened and about when they should start that screening process.
That is a great question. So it really depends on risk level. So women who are considered at average risk, so these are women who have no personal history of breast cancer, no strong family history of breast cancer, and they don't really have a known mutation. So we know there are gene mutations that can cause that risk level to increase, the most common being the BRCA gene or the BRCA gene. They typically need to start screening starting at age 40, and that's yearly with mammograms. Now, after age 55, the recommendation is at least every other year, but it really depends on risk factor and levels. And so we always encourage our patients to talk to their provider once they hit age 55 to see if every other year or annually would most benefit them.
Okay, let's talk about
those that.
Oh, go ahead.
Yeah, so I want to talk a little bit about women who have high risk for breast cancer. So those are women who actually have a strong family history of breast cancer, or if they had personal history in the past with breast cancer or chest radiation at a young age. So those individuals would actually get screened much earlier, starting at age 35, with a breast MRI and mammogram yearly.
Okay, that was going to be my next question about what does the screening process look like. I think most people are familiar with the term mammogram, but you just mentioned MRI. So is that something else that we should be doing?
Yes, so that's a great question as well. So, typically our screening tools were mammograms, which are x-rays of the breast. Now we have actually digital and 3D mammograms, which help kind of locate more of the more smaller tumors and those women that have smaller and denser breasts. There's also breast MRIs that actually target the breast tissue most specifically and can actually reveal more, especially for those women who have higher risk levels for breast cancer.
So if you have the higher risk level, you should do the 3D technology there with your mammogram, whereas maybe if you aren't, then the regular 2D would be sufficient?
Yes. So, and that definitely, of course, goes along with all the risk factors like family history, known genetic mutations, which is why as these patients see their provider, it's really important to really know your family history. That way the right screening test can be ordered for them.
Well, yes, and it doesn't discriminate against men or women because it can also affect men, which I think some people may be surprised to learn.
No, absolutely. And, when we look at risk level as well as in the United States, how many men get breast cancer. Out of 100 breast cancer diagnoses, one of them is male. So it is 1%, and it's not as common, but it's surely still significant. So we always like to remind our men, too, that they can get breast cancer.
All right. Well, thank you so much. Even though it's not October, it's still important to know what to be looking for, those risk factors like you mentioned, and some of the things that you can do to monitor your care and be proactive when it comes to your health. And we appreciate you being with us this afternoon.
Great, thank you.
All right, there's a look at the Aunt Martha's Facebook page, which we will connect you with, as well as their website. And we will share all of that information on our website, CILiving.tv.